Hey everybody, welcome to the Athletic Potential Podcast. This is episode 8, and today we're going to talk about hamstring injuries. We're going to talk about stretching hip flexors, as well as core strength training and training the shoulder muscles for endurance. All right, quick intro of me. I'm Mike Matthews. I'm the owner of Athletic Potential, and as a quick overview of each episode, we will go over a case that I had just recently treated. Usually it's the last case I treated before this recording of the podcast. And then we'll go over questions that we received from our listeners and other clients. So let's jump right in. So my last client I just treated, kind of an interesting case. I'll tell you the full story from the beginning. So I was just finishing up work for the day, and I got a phone call from the father of one of my clients, former clients, and he said that his daughter just sustained a hamstring injury within a few minutes ago. He was actually walking down the bleachers to go see how she was doing on the sidelines. And so he had walked over and was talking to me on the phone, and so we were able to actually get treating this immediately and give him advice. And so I'll go through that whole scenario. She was about attempting to sprint down the field to win a ball and pulled her hamstring and had significant pain, couldn't run anymore, and had to be, had to go off the field. And so in talking to him, the initial thought was the trainer had come over and asked, what was going on, assessed it, and found out she had a hamstring injury, and immediately had suggested that she stop playing and that she get off of it and ice it. Now, in her case, with the symptoms that I was being told, I decided that actually ice was contraindicated at this point, and I wanted her to continue to move and not put ice on it and not be still, because the severity of the injury didn't seem as bad. She was able to walk off the field. Nobody had to carry her. There was no significant pop. There was no major injury traumatically. And so in her case, she says, I can walk. It's moderately painful. I think she said it was something like a 4 out of 10. But she was able to walk off the field. And so I told her, I said, I need you to keep walking and I need you to keep moving. And what we need to do is keep movement going, and we need to increase blood flow to the area as much as possible to decrease the chance of swelling, as well as to decrease the chance of her getting really stiff and losing significant amount of range of motion from immobility. So what we did was that she came over directly after that conversation to our facility. I assessed her. She definitely had a more of a proximal or higher hamstring injury. It wasn't near the bone, so it wasn't a tendinous injury. It was more of a muscle. And so I prescribed her with a protocol that included three things. So heat, to actually decrease the tension in the muscle that she was experiencing. She was pretty guarded. So we prescribed heat, and then I prescribed short walks, about 5 to 10 minutes, to keep her moving. And then when she was not moving, I had her perform long duration protocols using a muscle stimulation device to basically just allow for the continuation of blood flow. Now, the main reason I wanted to do this is I really didn't want her to stiffen up. I didn't want to lose range of motion, and I definitely didn't want her to have an increase in swelling, mainly because she still had a few more games to go later that week, and the only chance we had of getting her back on the field within about 5 to 7 days, barring that it was a small enough injury, was to not have her go through this ice protocol that most people go through. And so we put her on the muscle stimulation device. That was a long duration protocol, so it had to be non-fatiguing muscle contractions, so the muscle actually flexes, but it's not significantly hard, and it can be done for long periods of time. In her case, her first day protocol, she was on the electrical stimulation for 8 hours, and we had her sleep with it on. And then she woke up the next day. She went on a 10-minute walk in the morning. No stretching, just walk. And then when she was done, she was to put the machine back on, and she wore it for an additional 4 hours. And she was actually doing walks every hour with the machine still on. She would just turn down the intensity. Now, her pain levels actually stayed fairly low through the whole process. So 4 was the highest pain she talked about after the injury. Initial injury was a lot higher, but she only had a 4 out of 10 pain, so we were able to keep her moving, and we were able to keep the muscle stim device. I ended up seeing her the next day. So I saw her the day of injury, then I saw her the next day, and we assessed her range of motion, and she had about a 20% loss, or sorry, a 20-degree loss of hamstring length compared side to side. So I had her continue the walking protocol. I had her continue on the electrical stim device throughout that whole day, as well as through the whole night. So I think she ended up wearing it for about 10 to 12 hours that day. It was anytime she wasn't moving, she was supposed to have the device on. And she adhered to the protocol really, really well. I saw her the following day. So, and then we reassessed range of motion. Her range of motion had improved significantly. So she actually only had I think it was a 7-degree lag. It was around 10 degrees, but specifically 7-degree lag or lack of mobility on the one side. And she had no swelling at all. And her tenderness, when I poked around and just kind of moved things around, was significantly lower than it was the day before. We maintained this same protocol for the next 4 days, and she was able to jog without pain within 5 days. Unfortunately, the pain, she wasn't able to sprint, which means she did have to miss another game and then a tryout, I should say a showcase later on that day. However, the fact is that we were able to manage that, something that would be pretty substantial. Usually, we were able to manage it to the point where she didn't actually have to lose time, lose range of motion and lose strength, nearly as much as she would have had she gone immobile and iced and done those other protocols that are pretty normal. So upon her last treatment, we tested strength. So it had been about a week and a half, 2 weeks now. We tested strength, we tested range of motion, and both were normal, and her pain levels were nothing. So she had zero pain. And she was able to start a jog and run protocol now, and it looks like she's going to be able to participate in soccer here within about 2.5 weeks from her injury, which, if you look at hamstring data, is really, really, really short, which I'm really excited about. So I think in a large part, the reason why she's been so successful in her treatment is because we were able to get to it at the time of injury almost. And then, to be honest, I think the thing that saved her the most and has allowed her to progress so quickly back is the fact that we did not immobilize, meaning we did not follow the RICE protocol that everybody likes to follow, that everybody suggests that you follow here. I think was contraindicated for her. We didn't rest it. We had her continue to move. We did not ice it, which I think actually would have altered and slowed down the healing process and her ability to get back to sport more quickly. I think it would actually have been contraindicated, like I said before. I think it would have actually set her back had we iced her. We didn't compress it. We allowed free flowing of blood flow throughout the area. And elevation, she might have elevated it. I think she did. She said she elevated only because the pain levels were less, and it was just a more comfortable position for her. But I'm not sure the elevation really played that much of a role in regards to anything in regards to swelling or those type of things. But I think the muscle stimulation device worn for such long periods of time, and the fact that we never stopped moving, is what allowed her to be able to return so quickly. So kind of a cool case. We've seen the same pattern in other cases before. More recently, we had an ankle sprain that I put through the exact same protocols. That patient came to me about 2 days after the ankle sprain, and they had done the typical RICE protocol. And I feel like for the first day and a half, we spent just trying to get the healing process started again because of the RICE protocol. So I think if by avoiding that protocol, the RICE protocol, rest, ice, compress, elevation, we were able to really get her moving and get her back to start working on strength and those other things that are needed to start rehabbing after a hamstring injury. So kind of a fun case. We've definitely, like I said before, seen this in the past where we've not done any ice, we've not done compression, we definitely didn't rest it. We've just moderated activity. We use pain as our guide, and most of our clients that we've gone through that protocol, and I'd say we've definitely done quite a few now, from everything from elbow injuries to shoulder injuries, hamstrings, other muscle strains. We've seen really good results with this protocol. It does take a little bit more of active management. However, if we can get to those injuries quickly, I feel like we can get people back quite a bit faster because we negate any negative effects of immobility and icing. So anyways, that's our case. And so let's go on to questions now. And our first question is from Skylar. Oh, and just to remind everybody, if you do have a question for the podcast, please visit the website, www.athletic-potential.com/podcast. On there, you'll see a button. Just click the button that says ask a question, and it'll ask you to fill out your question and some details there. Also, just as a reminder with the questions, if it is a very specific answer, I try to answer those via email or back to you that way. And then the answers here on the podcast may be a little bit more general to be more applicable. And I try not to give out very specific advice to your case on the podcast, just because it doesn't seem to work as well generalizing to everybody else. So we cover a little bit more key concepts, but I'll answer every question that I can, as specific as I can. And if it needs more of a specific answer, then I'll respond to you directly. So send those questions if you do have them. So let's jump into these. So our first question is from Skylar. He says, every season I seem to get hip flexor tendonitis. I feel like I am decently strong, but I can't seem to find the best way to stretch the hip flexors. What is your go-to stretch for your athletes? Okay, so Skylar, a couple things here. I really don't have any context, so I'm going to do my best to answer this question. So I don't know your sport. I don't know how old you are. And so I'm going to make some assumptions and to generalize it. So let's assume you're a high school athlete, and let's say you're a running athlete, because those typically have some hip flexor things, even though we do get hip flexor issues in most of our sports that we treat here. So every season you seem to get hip flexor tendonitis, and you're talking about stretching the hip flexors. So I can tell you right now, we'll get to my go-to stretch of the hip flexor in just a second. I don't know, well, depending on your sport, I would definitely want to make sure that you're actually getting tendonitis because you have short hip flexors. So we need to test your hip flexor length. There's actually an easy way to do this on your own. And it's just through a test that where you lay on a table, let your legs dangle off in a certain way, and if your legs don't fall certain distances towards the floor, then you know it's a hip flexor problem. It's a pretty easy self-assessment, and if those demonstrate that you actually have a shortened hip flexor, then I would target it with stretching. But I would also ask the question of, why do you have short hip flexors in the first place? If it's sport specific, mainly because maybe you're a sprinter, or maybe you have your sport demands those kind of demands on your hip flexors, and maybe that's just they've starting to shorten over time and through activity, then yeah, a gradual lengthening process of the hip flexor is a good idea. However, a lot of times hip flexor stiffness actually comes as a compensation to poor ability to control your lumbar spine or your lower back. So you have poor core control essentially. And so your hip flexors try to act as a core or spine stabilizer to hold the spine in position. And so they do two things. They try to hold your spine in position and move your hip at the same time. And so that's double duty. And in a sport that with high hip flexor demands, that can easily lead to hip flexor tendonitis. So you actually can stretch your hip flexors all you want, but unless you fix that underlying cause, you're just going to continually get hip flexor tendonitis. And it sounds like, based on just the way you worded your question, every season I seem to get, it sounds like there's probably an underlying problem to your hip flexor tendonitis, and it would need to be addressed before you get into it. So I tell everybody with hip flexor tendonitis is realistically, and we test very specifically here in the clinic, but however, when we start with this, let's make sure your hip flexors are actually stiff, meaning shortened, and then let's actually look at your core stability. And the best way to test for that is a 2-minute plank. Now, your plank needs to be in good position, and if you don't have good position, you could do a 2-minute plank and still have major problems with your stability of your spine. So, but the easiest way we test for core stability and your ability to maintain core position over time is a 2-minute plank. Now, we don't train 2-minute planks. Actually, the longest plank I do in clinic is 30 seconds. But the 2-minute plank tells me a lot about a lot of different things, and one of which is, can you maintain your spine stability for that long? And it also tells me how you do it, which is also very important. So, but anyway, so coming back to your question, let's make sure your hip flexors are actually stiff, and that's the and that they're actually stiff because of your sport, and it's not for some underlying issue. And you do that through a test. It's called the Thomas test, THOMAS test. You can Google that and look that up and try that, and then do a 2-minute plank with good form. And if you notice that you can't do a 2-minute plank with good form and you have tight hip flexors via the Thomas test, then I would actually start with a good core control program first, and then worry about lengthening my hip flexors later. Now, talking about my go-to stretch for hip flexors, it actually doesn't look like a stretch. Well, it looks like a stretch, but it isn't a stretch at all. It's a position where you're in half kneeling. You're half kneeling, you get as tall as you possibly can, your abs contract, and you only move a few inches when you go to move forward into the hip flexor stretch. And so the best way to demonstrate this, or to see this, is you can go to my YouTube channel, Athletic Potential, and look up half kneeling hip flexor rocking, I think is what it's called. And you'll see that demonstration. It looks a lot like a normal hip flexor stretch, except I'm only moving like an inch to try and get the hip flexor. And that is because we've engaged the core, we've taken the pelvis and we've put it in a very specific position. And then we've slowly moved into the position to try and stretch the hip flexor. And that's by far the best way to stretch a hip flexor that we've found for those that have kind of the chronically shortened hip flexors. And so, Skylar, I hope that answers your question. Like I said, there's a lot of things I don't know here. If you're somebody that is really mobile, meaning you do the Thomas test and there's no indication that your hip flexors are actually stiff, stretching your hip flexors could be very contraindicated and actually the problem in causing part of your tendonitis. At that point, you really have got to ramp up all the muscles surrounding the hip to create a stability about the hip that's going to help that hip flexor not work as hard and therefore not get a tendonitis. So I hope that helps. If you have more questions, or this didn't really address what you were hoping for, Skylar, just you can email me back, or you can just reply with another question as a feedback through the website. So I just want to make sure that we cover that for you, and that we get you a bit of a solution. So reach out to me if you have any more questions. Okay, let's move on to question 2. So question 2 is from Caitlin. When I pitch in softball, I get lower back pain towards the middle and the end of the season. What have you seen in softball pitchers that causes low back pain, and what are some suggestions to help get rid of it when it does come on? This actually ties really good into Skylar's question of what we already covered, and that is your ability to maintain spinal stability. So in the softball pitchers, there's a couple key parts of the windmill delivery that produce significant amount of back strain, especially if you don't have good spinal stability. The main area that we notice is when the front foot contact hits, and all the momentum that you've generated from the pitching rubber goes forward and stops. And it's typically as the arm is coming down from what we call a 12 o'clock position, as it's coming down towards the 6 o'clock position in almost ball release, it's in that position there. And so I would consider that is where you want to start to consider maybe that's where your back pain is coming from. That's typically the area of highest stress of the pitching delivery. There's a specific part of the windmill pitch. So when your front foot contacts the ground and all your momentum stops, your back can go into hyperextension in the lower region, and that can create significant amounts of stress, especially if you have poor anterior core, so anything on the front side. So think abs, obliques. If you don't have good ability to control the anterior core or control that position, then what can happen is your lower back will extend and create high compression. So it actually kind of, I hate to use the word smash, but it basically just compresses or smashes the bones together in the front. And then what ends up happening is, over time, how many throws you throw at high intensity, you essentially start developing pain in those regions, either from the disc or the bone or other things. So it sounds like, Caitlin, when it comes to this, it's mid to the end of season, so you don't have it in the beginning of season. So to answer your question a little bit more, I'd be curious to see what we talked about 2-minute plank with Skylar's question. But if you can do a 2-minute plank in the beginning of the season, I wonder what a 2-minute plank looks like in the middle of the season, and especially towards the end of the season. And if you start noticing that you're unable to maintain that 2-minute plank, or maybe look at some video and we start noticing that you're extending your lower back during that specific part of the windmill delivery, and we see that, I'm willing to bet that you're just progressively losing the ability to maintain spinal stability, or core endurance is probably the term I would use here. I think you're probably losing that over the course of the season and fatiguing out. And all you would need to do is just make sure you're performing enough of a maintenance program in your core stability that should probably take care of a lot of it. And so that's where I'd start looking at maybe, maintaining a core stability or core training program throughout the course of the season if you're not already doing so. If you are, then I would start looking at through into the hips. And I think the hips are probably at that point fatiguing, meaning your hip flexors, all the glute muscles, all the little glute muscles that exist in the hip, those may not be working as well as they should be, and then that's putting undue stress on your lower back. The only other thing I'd say look at is if you have video, you can look at mechanics. Make sure your mechanics aren't changing over the course of the season, just with general fatigue, anyways. But the other thing I would be looking at is as you start getting into different parts of the season, I would make sure that you're still doing some sort of maintenance weight and strength conditioning program. And if you haven't done a strength conditioning program, that's probably where you start. And to be honest, that's all you would probably need is an off-season strength conditioning program. And then you would do that. That builds up, I hate to use the word base, but it builds up a base of endurance and strength that will allow you to get throughout the course of an entire season. So the other thing I would say is biomechanics play a role here. This is where usually pitching coaches come in and they can identify some of these faulty movement patterns that you have when you pitch that you just may need to tweak the way you're landing, or the way that your front foot is contacting the ground when you go to get to ball release. That may be causing it. And that's a mechanical flaw that just needs to be fixed with practice and good coaching. And so that may be also the cause. So, Caitlin, I hope this answers your question. My biggest thing is I think we see with our softballers is that most of them don't maintain a good core endurance training program throughout the course of a season. It doesn't take much. A 2-minute plank is a test. It's not a training program. It probably won't help you. You need more of a dynamic program that will actually improve over time and kind of match your demands of the course of your season. But I think in your case, start with a core training program. Make sure you have one. If you don't have one, then let's get you on one, and then monitor your core endurance throughout the course of the season. And then if we're still looking at issues, I would consider having a pitching coach look at it and to make sure there's any mechanical flaws that you get those figured out and fixed. So, Caitlin, I hope that helps. Let me know if you have other questions. Follow up with me. All right. Looks like our last question today is from John. My son is a high school aged pitcher. He does really well until towards the end of the season, when he starts to notice arm fatigue and sometimes pain. He performs arm care exercises, bands, etc. consistently, but seems to always have this issue. What are your thoughts as to why and what can be done about it? So definitely a common thread running through these questions. You can probably tell what course of the season we're in right now, and that is, we're talking about fatigue. We're talking about mid to end of season. We're talking about tendinitises. We're talking about these little things that creep up on you as season goes along, especially if you've been playing more or higher volumes. But you can. Well, let's get into the question. So basically, he's asking, what are your thoughts as to why this is happening? So arm fatigue, those type of things, and then what can be done about it. Now, let's go more specifically here to baseball and pitching. So one of the things that I've noticed, and again, John, I don't know what your son's doing for his arm care program, but one of the things that we introduced into our arm care program, and our arm care program here includes everything, not just the arm core programming. Arm care is just kind of title for it, but it includes elbow, it includes forearm, it includes shoulder. But in traditional senses, it usually means a lot of shoulder, right? So as we're talking about shoulder, specifically, one of the things that we've instigated here at Athletic Potential is that we have 4 different arm care days. And so 4 different shoulder programs essentially that we do that just rotate throughout the week. So it's not one band program, done every time. It's 4 different programs that are done. Now, I'll walk you through them a little bit, not specifically the exercises. If you want the specific exercises, it's on the YouTube channel. Go ahead and look those up there. But there's 4 different days. So we have a band day, which most people kind of understand those, that most people do those, the J bands, those type of things. Then we have a free weight day, which usually we use plyo balls and dumbbells, depending on how strong somebody is. And then we have what we call a ballistics day, which is where we teach the muscles of the shoulder to move quickly. We use that with reverse throws and catches and drops and those type of things, typically using plyo balls of different weights. And then we have a 4th day, which we call an isometrics day. Now, I want to specifically talk to you about the isometrics for your son, John, and that is one of the things we found is that all the other exercises don't typically train endurance. They train either strength or they train power, the ability to move quickly. Now, the free weights use strength, bands use strength predominantly. The ballistics are all about speed. We're trying to teach speed with that movement. And we realized that we needed an endurance component to arm care because most of our guys are throwing, and girls are throwing a lot. And so we introduced isometric day. Isometrics essentially just means you're flexing a muscle but not moving it. So imagine just flexing in the mirror. That's an isometric, right? And so in regards to arm care, we go into 4 different positions. All are at end ranges of rotation. So 2 end range internal rotation exercises, 2 end range external rotation exercises. And we performed kind of a very specific, what I think is called a pyramid rep scheme. And so what we have almost all of our athletes do is we start at, you do 6 reps for 10 seconds. So you'd hold a position without moving it for 10 seconds, relax, go immediately into the next one. That relax period is about a second long, and you do 6 in a row. And then at the end of the 6 sets of 10 seconds, you rest for 20 seconds, and then you do the exact same exercise again, 4 sets of 10 seconds. Then rest 20 seconds, and then do 2 sets of 10. And then you're done with that one exercise, and then you would go do the other 3 because there's 4 total. And what we have found is that those that train endurance that way, we've had a lot less issues of guys complaining of arm fatigue throughout the course of a season. And they maintain this. There's a maintenance program, which I also think plays a big role. A lot of times we don't maintain things very well. We're doing too much exercise or not enough. That's a whole nother concept. But realistically, I think you need to introduce some sort of endurance training into your arm care program if you don't already have it. If you do already have an endurance part of that program, then the next thing I would say is look at how much you're doing your arm care. A lot of times we see arm fatigue towards the mid to the end of the season is because guys are still doing their off-season arm care program in season. And we teach here that throwing is an exercise. All the muscles that you use during the J bands and the free weight exercises and all those type of things, those are the specific muscles that are used during throwing. Well, if you go out and you throw 30, 40, 50 pitches, 60, 70, 80 pitches, and then you go do, after the game, you go do another 3 sets of 15 repetitions through your J-band program, those muscles are already fatigued. And then you just put them through a whole nother round of exercises after they're already fatigued. That's typically going to lead to either an overuse or overtraining, and then they're going to fatigue and then eventually not be able to perform or run into problems, hopefully not injuries, but that can happen. So the other thing we've instigated is high intensity throwing days with an arm care program that reflects that. So typically if someone goes out and has an outing where they throw 30, 40, 50 pitches, then that day they're going to do either one set of their scheduled arm care program, whatever that is, bands, free weights, isometrics, or ballistics, typically not ballistics, but they're going to do one set, and the entire point of that exercise is just to get a little bit of blood flow to the area to try and help facilitate recovery. That's it. I've been leaning more towards the isometric day post-throwing and only doing 4 sets of 10 seconds per exercise at that point. The whole goal of a very submaximal contraction on the isometric, just turn the muscle on, get a little extra blood flow to the area, and be done. And that's pretty much what we've been doing. And so far, what we've seen is good results. Some of our pro guys are still not even to the heart of their season yet. And so we're seeing how those guys turn around through the season and how they do. We know our high schoolers definitely benefited from it. We had less arm fatigue when those guys that worked with us, and they feel like they had a little bit better season that way. And so some of our travel ball guys will still go out and play. And so we'll see how they do. Our collegiate guys are just finishing their season, so most of those guys had great seasons. Didn't really complain of arm fatigue. So far so good. But John, in regards to an answer to your question, I think the thing you want to start with first is consider looking at if you're not doing an endurance training program. Part of that you can get on the website on my YouTube channel, and I think it's called Isometrics program. It's 4 exercises. You can look that up, and then do the 6 for 10 seconds, rest for 20, 4 for 10 seconds, rest for 22 for 10 seconds protocol, and try that and see if that helps. If you continue to run into issues every season, you need to maybe start looking at mechanical flaws or other things that are not working nearly as well as you wanted to. And so I would start there. And if that doesn't work, reach out to me and let's figure it out so that this can stop happening. So, all right. Well, that's all the questions we have for today on the podcast. As a general takeaway, I think we saw a general trend here, and that's talking about endurance training as well as core training. So a couple things to take away. One, if you're not incorporating endurance type exercises into your training program, I highly recommend you do it. Now, in all honesty, it needs to be sport specific, geared towards what you're trying to get done. However, anything is probably better than nothing, but if you have a very structured program directed right at what you need, that's probably your best bet. So maybe reach out to a coach, reach out to us. We'd love to help you out if you have questions there, if you need more specific guidance, we can definitely help you there. And the other thing is, in regards to core training, I think one of the things that most people neglect is a lot of problems that happen in the hip and happen in the shoulder, and specifically with throwers, actually come from poor core endurance and core ability to maintain spinal stability. So consider looking at ways to test that throughout the course of the season, and to make sure that you have a really good off-season training program that incorporates good core control and stability. And I think you're going to see very positive results as you go throughout the course of your seasons. So, well, that'll do it for episode 8. I appreciate everybody who's listening. If you would please rate and review the podcast so that we can reach more people, and then ask questions when you have them. Go to the website, www.athletic-potential.com/podcast. Ask your questions there. We'd love to answer anything. And if you have any other needs, please reach out to us. We'd love to help. And thanks for listening, and we'll talk to you next time.